Welcome back to the Healing Wellness Show, sponsored by Iowa Wellness Center. I'm Dr. Kareem, and today we're going to be talking about the myths of neuropathy. We're going to be breaking down the myths and that are confusing neuropathy sufferers out there. Today, I'm joined by Mark. Mark is going to be asking us questions from the audience here. These are questions from my area, the corridor area here in North Liberty.
So some of the questions we have here, one of them is, is this a myth? Neuropathy only happens to diabetics.
No, neuropathy, absolutely, that is false. We see neuropathy connected to inflammation. It could be connected to like Lyme's disease, chemo-induced neuropathy, which is from chemotherapy, autoimmune conditions, metabolic dysfunction. It could be also circulation problems, could be surgeries, medications. There are lots of medications out there that do cause nerve damage. So there's lots of different things that could cause that. So that is absolutely false.
Is tingling, it's not serious, is it? If there's tingling in the body in the feet.
So tingling is often the early warning signs that the nerves are stressed. So think of it, it's like in a car, that's your yellow light warning, right? If you cover it up, then you're going to get a red light. If you cover that up, then eventually that car stops to work. So that's kind of the early sign. That's your yellow sign, is what I would say that is like in the car.
If medications help pain, the nerves are healing. Is that correct?
Pain reduction doesn't necessarily mean that the nerves are recovering. So, no. And a lot of times, what medications are doing, they're covering or masking the symptoms. And that's why in our clinic, we eventually will see patients are really bad and medications are not working for them anymore. Because typically, what happens is you get on medications, it's, for example, like gabapentin, you're 100, 300 milligrams. Well, a few months go down the road, you're feeling great. Well, now pain is starting to come back. Well, now let's up that dose to 600 milligrams. Well, you're feeling good again, and then it starts to come. Well, let's up it to 1200. Let's up it to 2600, which is usually max. So that's usually the chain reaction. Or hey, let's switch you to another medication that's similar. But all these medications are decreasing nerve activity. I've talked before in episodes before where nerves should fire at 270 miles an hour. So if you're decreasing that nerve activity, well, that nerve is dying. And that's why it's going to increase in your symptoms over time.
What is working for people?
The best results usually happen when people combine a nerve stimulation, a circulation support, oxygenation, metabolic health, and also decrease in inflammation in the body. So again, that is what I've talked about before about relief protocol, what I've come up with, which is all these components to help get that nerve stimulated again.
Good. We're going to be doing the outro on the hook here.
Yeah. The next episode, we're going to be diving into one of the most overlooked causes of neuropathy, and that's poor circulation and oxygen deprivation.
Mhm.
Neuropathy myth: if my pain is less, my nerves are healing. Not always. I'm Dr. Kareem, and on the episode, I'm going to be explaining the biggest myths about neuropathy, why some treatments fail, and why the relief protocol that I've created focuses on more than just symptoms. The next episode that we're going to be talking about is poor circulation and neuropathy. So go ahead and follow and subscribe to listen to our next episodes.